a good place to smile to your colleague seated beside you and wishing that person a happy new year. Yes, that is happy new year. Wish for greater heights. Yes, not cheap more, we'll see.
And actually, it was a time I was in dying of money. Well, registration for my program was almost due. So I actually applied through the GRNMA Infonet app, and within a short time, I got the money and then I used it to pay for my fees. In fact, GRNMA has done a lot, and I'm entreating all nurses to come together so that they can all benefit from all the. It's not only the loan; they have a lot of other packages, disaster, name it, pension benefits. We give a lot, even more than what the applicants are expecting. So I entreat all nurses to come together and come and register under the GRNMA to benefit as a GRNMA member. Thank you.
My name is Jacob Kwame Abochi. I work at
Accra District Hospital and a member of GRNMA. I'm a nurse with a specialization in otorhinolaryngology nursing, and I have benefited from the package of a loan from GRNMA. I want to seize this opportunity to thank my district executives who were up and doing when I first submitted the first process through the online process. They came in and then did their part. The region also did their part, and then national. I want to also say that the process was very smooth, and the loan came at the right time when I needed it to pay my school fees. And I benefited, this is the third time I am benefiting from GRNMA. And I want to seize this opportunity well to thank our able president, Madam Perpetual Ofori Ampo.
Hello everyone.
Excuse me to say, the Ya Asantua of our time. Ayiko, long live GRNMA, and unity is strength.
My name is Shiashie.
Yes. Today is a very important day in the lives of MNS and midwife in this country.
And
of course, you can only get this from Ghana Registered Nurses and Midwives Association, the association that has its members' welfare at heart. And it's very important that this day comes to being, to cement all that they have said the past 8 years that they have been with us. So please, relax and let's take it through. Thank you. This morning, we have, of course, the beautiful Perpetual Ofori-Ampo for the president of Ghana Registered Nurses and Midwives in our midst. We also have the president. We also have the president and CEO of TruMerit in our midst, in the person of Dr. Peter Peziosi. Yes, we have reps from the National Executive Committee and the person of our Assistant Secretary in our midst. Should I do the first? No. Mr. Sopali in our midst. He is a chief as well. And we have our National Treasurer, Mr. Moses Anyingba, in our midst. Yes, we have reps from the various regional executive committee in our midst. I'll call you as and when it gets to my table, but please give us a wave. And all our district members and local members represented here, everyone is welcome. The media, those of us watching from home, you're also welcome to today's August program. My name is Sandra Fori, and I'll be your MC for this program. We start with our opening prayer, and to do us the honor, we have our Reverend in the house, who is also Assistant PR of our great association, in the person of Reverend Philemon Japon. Let's honor him as he comes.
All right, thank you for the opportunity. It's a new year. I think we shall rise to take the prayer. All right, thank you very much. Shall we pray? Our dear Lord and Master Savior, we are grateful unto you for bringing us into 2026. Thank you for the goodness and the mercy that we continue to enjoy in your presence, in your Vineyard. And thank you for bringing us this far. We thank you for GRNMA. We thank you for TruMerit. Even as we gather to have this MOU, we pray that it will go a long way to strengthen the bond that we have. It will bring together a lot of great opportunities for our DNSs and midwives, both in country and abroad. And it will give us the opportunity to even explore other opportunities this year and beyond, to travel, to have working experience outside. We also pray, oh Lord, for the leadership. We pray for wisdom and understanding to steer the affairs of the association in 2026, even as we begin. We thank you for the nurses and midwives in this country and beyond. We pray that continue to guide us, protect us, and help us to give the best of care to the patients who we nurse every day and out. Thank you. In Jesus' name we have prayed. Amen.
Standing for the anthem. Can we please keep standing for the anthem, please? The GRNMA anthem. The anthem is about to start. Okay, shall we please be seated? The anthem will take place later. Yes, that's the GRNMA anthem. Joining us is the General Secretary of Ghana Registered Nurses and Midwife Association in the person of Mr. David Chum Tenkran. Dr. David Chum Tenkran. My apologies, sir. Okay, so we roll on. Currently, we are seated here. We have somebody to tell us what exactly we are looking for, what is happening today. Of course, it's a signing ceremony, but what are we truly signing? What are we going for? Is it for the benefit of anything that comes with it? And the best person to do this is our president. And she's here to tell you what you should expect and why she's doing this for you. Please, let's honor her while she comes.
Unity. 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 I hope you're all doing well. I'm really happy to see all of you. And I hope those who haven't joined us yet will join us. For those of you who are online, we are grateful for your time. And it's a pleasure to see you all in the new year. So happy new year to each and every one of you. Dr. Peter Preziosi, President and CEO of TruMerit. We have Dennis here, who is part of the TruMerit team. We have those who have joined online, national executives here present, regional executives, district executive members here present. It's a delight for me to see this day come to reality. Discussions for this started about 2 months back, but I will say we have really fast-tracked a lot of things to make this happen today. The signing of the MOU between TruMerit and GRNMA. It is my greatest pleasure that we are signing this MOU in the face of the numerous challenges health professionals are facing. And I'm sure if you are given the opportunity, you all mention one thing or the other. But I think the biggest is the unemployment situation for the 2021, 2022, 2023, and 2024 cohorts of our colleagues who put together are in the thousands, over 100,000, who are still waiting to be employed in Ghana's public health sector. It is really not easy when you even want, when they are seeking employment in the private sector, because the private sector is also huge, and they also require certain things. They are very careful about the turnovers and don't want to invest in you, and then at the end of the day, you leave them. So majority of them are still waiting on government to employ them. We are very much aware of the poor conditions of service. Current state in some facilities may be good, but generally it is not the best. And that is what also pushes some of our colleagues to migrate to high-income earning countries to make better sense of the socioeconomic lives that they want to have for themselves and their families. The lack of retention strategies is also a big issue. The fact that conditions of service are not implemented, and the systemic barriers that frustrate some of our colleagues in terms of career growth, in terms of innovation, and in terms of leadership. So these challenges have been not well addressed in our country, Ghana, I must say. And consistently, for the association since 2010, when we began researching into the intentions of our colleagues to migrate, these same challenges reflect in the study outcomes that we conduct. And for TruMerit, formerly known as CGFNS, they know very well what the push factors are and what the pull factors also are. And the push factors has also informed them to create a very beautiful platform. We'll be hearing more about it later, but a platform that will allow our colleagues to actually put their credentials, their CVs, and other certificates on a simple platform, which will be open to employers around the world, such that you can sit comfortably in your home, and if you have uploaded, if an opportunity comes, why not? You take advantage of it. But it's not about just high-income earning countries. Once it's a general platform, others within Africa and elsewhere can also have, even within Ghana, can also have access to it. I'm sure in the presentations that come after, we'll learn more. I will learn more. I believe you also learn more. And then you can ask the relevant questions that will put you in a better place to go back to your various facilities and also talk about this to your colleagues. So the MOU signing today is in the right direction. I want to say a big thank you to Dennis and Richard. I know Richard is online. Dennis is here with us. He's done a lot of the back and forth with Richard. And Peter, as he sits here so humbly, is not a small man. And to have him here with us today is an honor. He actually attended the GDNA conference, which took place at Kempinski Hotel from the 2nd to the 3rd. And of course, on the 4th, there was a hackathon and then a gala in the evening. And within that period, we engaged a lot, and he factored the signing into that trip so that he can be here in person to do it himself. So Peter, we are grateful for your time, and we are honored to have you here. And Dennis, we thank you, yourself and Richard, for all the work. So on this note, I want to say you are all warmly welcome to today's ceremony. It's going to be a short one, but a very beneficial one. You are all welcome, and I hope we engage fruitfully. Unity. 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 Thank you.
Thank you very much. We can keep clapping until she takes her seat, please. Thank you very much, Madam President. She enumerated some of the challenges facing nurses and midwives in their bid for career development. And of course, like we always say, a mother knows what her children go through, and she's quick to solve the problem for us. So thank you, Madam President, and your team for this program. Thank you. We have a short documentary. Please, is the media ready to give us the documentary for a documentary on global nursing from TruMerit? Yeah. Let's take a
Imagine a world without nurses. Our hospitals, our clinics, they'd just be empty buildings. There's not healthcare where there isn't a nurse involved. Not just hospitals, but it's communities, it's research, it's education, it's the military. Nurses make up about 60% of our global healthcare systems. And what those nurses are doing is not just providing care when you're sick, but they're providing advice and help to prevent you getting sick. If you are sick, to manage a condition so you live the maximum possible life. If you're at the end of life, to have a good death. You look right along the spectrum of life, all the aspects where you're going to have care, you'll find a nurse. Nurses are the backbone of our health systems. But the World Health Organization reports that we have a global shortage of nurses. When the demands on health systems become overwhelming, when they become incredibly urgent, how do high-income countries address that? They look overseas. They recruit internationally.
I wanted to explore being an ICU nurse in the United States because it's very limited here in the Philippines, especially with the technology we have, the ventilators and the patient monitors that we have. I wanted to be able to give more to my patients without constraints. I don't know anybody in Jersey. I'm really going there alone. All the what-ifs are in my mind right now. What if I'm only a good ICU nurse in the Philippines? That's what scares me the most.
I came from South Korea 30 years ago. I totally understand her. She's so brave, she come herself. Boom, language is totally different. And the electric charting, so difficult. She's learning so quickly, and I can give her all my knowledge, all my trick, and make her successful.
Nurses have always moved and migrated. There is intrinsically great value in migration and in movement. The sharing, the learning, working in other systems. But if we're committed to ethical recruitment, there has to be mutual benefit. There has to be some give back commensurate with what is being lost. And the ratio of nurses to population around the world varies hugely. There are many countries who are losing nurses that they can ill afford to.
On average, about 500 nurses are leaving every month. Every month. We are also having to deal with the dilemma of how to recruit our nurses who are at home, fully qualified to practice, but they have not gotten placement in a public hospital.
When you pass your exams, you have to wait for the government to post you. So you can be waiting for 4 years, 5 years, and the family will see you as not being useful. You become a burden on them. If there is an opportunity, an opportunity comes and I have to grab it, I need to grab it, then go find greener pastures.
I dedicate a lot of time in this place just because I love what I do. My help is really needed. That's basically why I'm still here. when the opportunity comes and I think I have someone to replace me here, I will take the opportunity.
We are just losing the best of our professionals.
I am on a mission to invest in the nurses here, to stay here in Ghana.
We can stay in our country and make it better. It starts from us.
Just like the saying, little drop of water make a mighty ocean. It's all our goal to make sure the care that somebody's getting in the U.S. is the same care that somebody's getting here in Ghana.
We think about health in terms of our village, our town, our community, or our country. But good health isn't made on the basis of where lines on a map are drawn.
Thank you very much. I think we have seen a lot. He is here to tell us what we should know and we have to know. So please, do me the honor. Let's welcome Dr. Peter Pezzerosi to the podium. We are honored to have you, sir. Thank you.
Thank you. Well, it is a real pleasure, a real privilege to be here today. I've had the opportunity to experience your culture, your people, and I have just been inspired and overwhelmed, and it's a real honor to be here. And before I get started, though, I would like to present a gift on behalf of TruMerit to President Perpetual, please. Around the world. You're an inspiration. Thank you.
Thank you so much.
I want to thank you for opening up your home today in the afternoon. I was honored to be elected this past November at a General Assembly of the Conference of NGOs in Consultative Relationship to the United Nations. I'm the first registered nurse to serve as president of that association. And it's an association of some 650 non-governmental organizations located around the world, involved in healthcare, climate change, spiritual well-being, and we are the bridge of civil society and non-governmental organizations to the United Nations. And this afternoon, I will be speaking and having a listening session with NGOs from the African continent that want more voice. They want to be heard at the United Nations. So we are helping them to be that bridge. Because historically, it's been very the global north of the European Union, North America, and we are now starting to bring voice to the Africa continent, as well as the Asia Pacific region and Latin America. So thank you, President Perpetual, for allowing us to have that listening session here. We appreciate you. I'd like to start with a Ghanaian proverb that I saw that, did I say that correct? Is it Ghanaian? Did I do that okay? I know, okay, thank you. I have to watch it, you know, it's difficult to, you know, they have beautiful words here, but sometimes as an American, we don't always pronounce them the proper way. So this proverb, it's about when you are sitting in your own house, you don't learn anything. You must get out of your house to learn. And I think that that really speaks to why President Perpetual and your organization would like to have a relationship with TruMerit. Because of the work that we do around the world, we serve mainly nurses, but midwives and 10 other health professions that are migrating around the world. Prior to this job, prior to my taking on the CEO position at TruMerit, I was working at the World Health Organization. And I helped them to build a global learning academy that is housed right now in Lyon, France. It was officially opened in December of 2024. But when I came on board as the president and CEO of TruMerit, I recognized that most of the work that we were doing was really centered around the migration of nurses and other health professionals coming into higher resource countries like the United States, Canada. We work with New Zealand and a few other countries up in the European Union. And I realized that in order to better serve the global health workforce, we had to do so much more than just look at the migration and mobility of health professionals. We recognize that migration and mobility, you can't look at that without the context, and the president mentioned this during her remarks around the workplace, the work environment, issues related to bilateral agreements from one government to another. Howard Catton spoke about that on the video. These are issues that we're looking at right now of not just mobility, but the types of practices, the ethical international recruitment practices that need to exist to protect, to make sure that mobility is safe and effective for all health professionals. In fact, we have a certification program in the United States, and we plan to expand that into other regions of the world where we certify international recruiters to ensure that they are ethical in the way that they handle health professionals. In fact, we've worked with the World Health Organization and their code of ethics. We've provided technical assistance to them. So we work very closely with WHO, not only on ethical recruitment, but on other issues. The other area that we really believe strongly in is how do we help to empower health professionals? How do we give them voice in terms of the skill and competence that they have, that they've gained, many of them on the job? So we just launched this past year a certification for global rehabilitation nurses. Because many nurses, they go in and they practice in rehabilitation facilities and they learn on the job. They did not necessarily learn those skills while they were in nursing school. And if they choose to leave that rehabilitation center to go someplace else, and if they have our certification, that certification says you are qualified, your skill and competence in rehabilitation nursing is in this certificate because you passed a qualification examination. That's really important. It helps to empower health professionals when you have certifications. And this is something that we are trying to work on across the world, especially in countries that don't necessarily have access to advanced education and advanced degrees. In the United States, we're fortunate there. I have several master's degrees and I have a PhD. I had the ability to get advanced education there, but that is not always accessible for individuals in other parts of the world. So we believe that global certifications that look at essential practice in specialty areas like rehabilitation care, like mental health, like elder care, like pediatrics. We're developing some pediatric micro-credentials, small learnings. So we'll be probably releasing that at the end of 2026. And so there's real opportunity there. And then lastly, we're looking at care delivery models. So, as Howard said before, you can't look at healthcare based on the lines of a map. Healthcare really is global, and it's going to only become more global in a digital health environment. With telehealth, artificial intelligence, other technologies that will allow us to work and provide care and services across borders. And this is something that we want to help prepare nurses, midwives, and other health professionals as the whole healthcare ecosystem around the globe will be changing. So those are several of our priorities, and we're really excited about the partnership that we're going to be having and the signing of the MOU today. So thank you very much. Did you want me to take any questions from the group, or?
Based on you want his UN former role at WHO, if you have any question for him? Are you sure?
Was that one?
Okay.
Is there one right? Did you want to ask something?
Maybe we'll put it all together at the last end.
Oh, okay, sure. Okay, thank you very much. Thank you so much.
Oh, let's do better for you. We can do it. We can do it. Thank you very much, Dr. Peter Pezrosi. He said a lot. I actually had a question, but like Madam President said, we'll put all together and then you help us with the answers. So we have another presentation on the salient aspects of the MOU, and to do us the honor is Dr. Richard Gakuba in the house. The video, we have a video before the... Can you please help us?
Introducing the Godwick Group, the world's first marketplace providing career, advice, and learning for the global health workforce. A lifelong career companion, our multilingual platform connects you with employers and ethical recruiters worldwide, ensuring proper representation every step of the way. Create your free AI-powered professional profile in minutes. Store and share credentials, certifications, access career guidance, and showcase your expertise, all in one secure destination. As part of TruMerit, your credentials are verified, evaluated, and your journey is supported. Your success is our mission. Like the Godwit bird, with one of nature's longest migration paths, your career journey deserves a platform built for the distance, whether across the street, the country, or the globe. For employers, access the world's most qualified nursing talent through a single, trusted platform with the Godwit Group support. Proudly partnering with the National Nursing Association of Kenya to serve the Kenyan nursing community. The Godwit Group. Your career path starts here.
come up. Yes. Let's see whether we can hear you.
Just a text message in the chat, just so I know that you're listening to me. About the MOU again, just thought I should highlight just those couple of comments and let the program continue. And I'm very glad to be connected to you. Although we didn't hear much of what was said earlier, heard about half of what Peter said, but we kind of struggled. So hopefully we'll follow the next speakers. Thank you.
So, Sandra, you haven't this one.
Hello. All right. So thank you, Join. Thank you so much. So it was we just received a presentation from Dr. Richard Gakuba. And before we take the next presentation, we also have Mr. Danny's in our midst, and we'd like to call him to also give us a presentation before we continue. Please help me welcome him.
To the President, the Ghana Registered Nurses and Midwife Association, your executive, President and CEO TruMerit, my colleagues, nurses and midwives. Good morning. You are well? All right. In Kenya, we say nurses hoye, and then you say hoye, all right? Nurses hoye. Nurses hoye. That means we are united and we are speaking one voice. I just want to add something very key on what Richard had said, and I know Jeff is also going to have some inputs. We know, we as nurses, what we are going through in our countries and in Africa. What we are going through in Kenya, it is what the Ghana nurses and midwives are going through. I mean, we are going to school, we get the skills and competencies, we graduate from universities and colleges, and then after school, we wait for 5 years, 6 years without employment. Is that what is happening in Ghana? So we want to have a balanced situation on how we as nurses, we can chart our path forward. And what I can say, there's nobody else who will come and build our house. We as nurses in Kenya, in Africa, in Ghana, we must chart our path. And these are the conversations which we have started with TruMerit and Godwit Group to support nurses and facilitate nurses, empower them, make them to be global, and they can work anywhere in this world. So I want to say thank you to our President Perpetual for allowing these great initiatives to come to Ghana. And also I want to appreciate President Peter for thinking about the nurses, not only in Africa, but supporting them through their journey to better opportunities in our global space. So what is being launched today as an MOU, it is very simple. In Kenya, we have already signed the MOU as the National Nurses Association of Kenya. We have signed and we have started. So how is it is working? We have a Godwit Group platform, which is a career development center under TruMerit. And how it works, you as a nurse, you as a midwife, you log into the platform, which is free of charge. You upload your CV. You put on your details as a nurse, as a midwife. And then in that platform, within this 2026, employers will be in that platform. You can see job listing in Canada. You can see job listing in USA. You can see job listing in Middle East, all over. So the platform is about supporting nurses to have options and opportunities globally. And what we are requesting from all of us as nurses, as midwives, it is to log into that platform. When we are united, when we have a pool of our professional competencies and credentials in that platform, you have a power to transform how we do things in Africa, isn't it? So that is what we are doing, and I know we are going to move forward. So I want to thank you again, President Perpetual and your team, for giving the Ghanaian nurses and midwives an opportunity to be in this platform. So I wish you the very best. I know Jeff will speak about it shortly, and we are going to move forward. The link to registration will be on in the next 3 hours, is what the technical team has said. So once the link is on, I know through the Ghana Registered and Midwife Association leadership, you will have it. Nasa Zoe! Midwife Zoe! Thank you very much, and may God bless you. Thank you. Can I take greetings to the nurses in Kenya? Yes. All right. So my name is Dennis Mbithi. I'm the Vice President of the nation.
Introducing the Godwick Group, the world's
unity. And that is so beautiful. And he just taught us that Nasa Zoe. Nasa Zoe. Zoe Nasas. Oh, okay. Oh, Zoe midwives. In fact, I'm following you to Kenya. Thank you very much, Mr. Dennis. Thank you. Thank you. So we have another presentation, and it's also going to be online. It's going to be online. Media team, please, are you ready? Yeah. Presentation from Mr. Jeff.
So I believe.
Okay. Good.
Thank you, Jeff. I hope you can see me now. I'm waving you. I hope you can see me. And Peter is right here by my side. Okay. So at this time, I guess I'll hand over to you so that we continue with the program as it is. Yes.
Yeah, so we have heard all that we need to hear about the memorandum of understanding between the TruMerit and the Ghana Registered Nurses and Midwives Association. Peter wants to say something. Okay, let's hear from Dr. Peter Pezersi.
I just wanted to add, part of our vision, we understand how life-altering it is when nurses, midwives, and other health professionals migrate around the world. And as Jeff mentioned in his presentation, it's about connection. We are looking to build a global cadre of health professionals ready to run to challenges, which we see every day. We see nurses and midwives that are practicing in war zones, conflict areas, helping care for patients and families in areas where there's climate change and disaster. So we know that we need to get a global cadre of health professionals that are ready to be mobile at a moment's notice. And we also understand the disparities that exist around the world, like what happens here in Ghana, where many go unemployed or underemployed. But I do want to say something. While I was at the GDNA meeting, I met so many inspiring nurses and midwives that are entrepreneurs, that have set up practices that are doing some very unique, inspiring work out in the community. Healthcare touches all aspects of our lives. Every single one of us, if we need healthcare services, it touches our lives as well as the people that we care for. So this platform, if you will, is really a platform that will allow people to connect with each other, to share their experiences. And you're starting it out with us, which is so exciting because we can create this and we can evolve it together. So I just wanted to add a couple of those other words because I just think it's so important that this opportunity is one of really helping to build and evolve a group of health professionals. And one of the wonderful panels that we had at the GDNA meeting was around interdisciplinary care. There was a pharmacist, a nurse, a midwife, a physician, a physiotherapist, all up there talking about the importance of collaboration, the importance of working to improve population health. So we hope that this platform will eventually evolve and to provide some of those other opportunities for all of you to stay relevant and to be confident and to feel empowered wherever you go to work. Thank you.
Thank you very much for that explanation. Thank you. So we've come to the question and answers time. Yes, and please, if you have any questions, just put your hand up and then the microphone will be sent to you. So please mention your name and then your question follows.
Thank you very much. My name is Jefferson Asari Dankwa. And my question is, first of all, I want to thank TruMerit very much for the opportunity and such a platform, a global platform. It's very good. My question is, we need some sort of certification before you can travel around the globe like you're talking about, NCLEX, IELTS, and all those that you need to enable you work outside Ghana or even travel outside Ghana. If I understand this platform, you already need to get all those certifications before you provide this on the platform. But we do not have such easy access, especially like NCLEX in Ghana. How is this collaboration going to make it easier for us to better ourselves in terms of certifications, to also be very competitive like our brothers who are in Kenya writing it day in and day out? Thank you.
Thank you.
Well, the National Council of State Boards of Nursing are responsible for the development and oversight of NCLEX. That is the licensure examination that's in the United States, and then they also have a Canadian version for nurses in Canada. I do know Phil Dickinson, the CEO of NCSBN, and we've had conversations. He is looking at the development of a platform to make the NCLEX much more accessible, because the challenge that they have is the test administration is done by Pearson VUE, and Pearson VUE does not have the same number of centers to administer the examination like what we use at TruMerit. We use another testing administration site called Criterion, and they have many more sites that we deliver our global certifications on. But I know that Phil is talking about developing a self-proctored site. Now that's still in development, and the concerns that NCLEX has and NCSBN, as well as we at TruMerit, is that if we do a self-proctored examination, we have to ensure that there isn't fraud and that the individuals are not doing anything. There are a few bad actors always, and you have to prevent that from occurring. So, but I do know that that's under development. We don't know when NCSBN is planning to deliver on that. But there, we could talk with them about a site in Ghana. And what we do, I know when we administer our examinations in China, we work with other test administration sites that we have relationships with. Many of them come out of universities. So there is a possibility. So I will go back and speak with Phil Dickinson about that.
Thank you very much. Yes, Mr. Dennis.
Thank you. Just to add on what Peter said, I know Peter keeps his word. So he will work with the relevant people to have this come here. Meanwhile, it is good to know that for the center, the platform which is being developed, for now, it doesn't need you to have that certification. But once you are linked to employer, there are those steps you need to take. One of the steps is having the exam done. And last time we talked with Perpetual, the Ghana Registered and Midwife Association, I know they are committed also to have this service here in Ghana. In Kenya, we got it. And majority of your nurses in Nigeria, they come to do the NCLEX exam in Kenya. The other thing I must say, we as an association, we have also started training nurses as part of what we should do to make sure they are competent to take the exam. So as we continue with the conversation, I know the President Perpetual will be also willing to sensitize and to see how you as nurses who are willing to migrate, you can have this opportunity to be trained on NCLEX. Thank you, and God bless you.
Thank you very much. Thank you. And of course, you are right on the part that you said, you know, the president would like to get the people here for us to write the exams right in our country. You are right on that. Thank you. Thank you. Oh, I think we can clap. This is good news. This is good news. Please, can we have some of the questions, please?
Good
yeah,
morning.
that's the one behind there.
My name is Michael. I'm asking two questions. One is going to my association, the GRNMA, and the other going to TruMerit. The GRMA own goes to the cadre of nurses we have in Ghana. It's in the general nurses, we are always at the beneficial side the most. Now the midwives are coming. The third group is the public health nurses. How are we doing to make them possible to take advantage of this opportunity for them to be able to write the NCLEX? And the one going to TruMerit is, I think mostly one of the biggest barrier is the cost in paying for this expense because they are in dollars, and when you convert, it's a lot of money. A lot of nurses are not able to afford. How is TruMerit going to do this so that it become a bit more affordable for most Ghanaian nurses to take advantage of such an opportunity?
Thank you very much.
Okay, I did not get the name again. Michael, all right. Michael, thank you so much for your question. So what we are doing now, this MOU, the platform that is going to be created is allowing you to put your credentials, your certifications, everything, your CV, so that potential employers can cite you and engage with you. If you happen to get such an employer, then the other necessities that requires you to be fully registered in that country kicks in. So this platform is not going to require you to write NCLEX or write CGFNS exams or TruMerit exams or anything like that. You are just going to have the opportunity to interact with global employers. Now, in terms of writing NCLEX, just like it's been explained, Kenya has it now. Through the National Nursing Association, they were able to get that linkage and have a center there. What we intend to do is also have it here. We have placed a request. You have done so. Peter now says, I am going to talk to the CEO and get Ghana a center. So what I'm going to do is follow up on Peter and ensure that we get this
It's
done.
a good place to clap, please. If viewers, you can clap as well once at home.
So,
it's a good place to clap.
Thank you. When the center comes into reality, then the other part of your question kicks in. How the dollars that you have to pay can be reduced. That's one. I don't have any answer to that. I don't know if Peter has any response to that, but I'm going to hand over the mic to Peter.
No, that's a very good question, and I know that this is a challenge in terms of coming into the United States. And what we find is that many nurses will go to another part of the world before they come into the United States. The requirements to get into the United States are generally much more stringent than any other country around the world. But what we do find is that, and I do want to caution you, Dennis and I talked about this on the way over today, is that there are international recruiters and employers that will underwrite the cost of your examinations and all of your requirements to come into the United States. I do want to caution you, though, and we were thinking about on the platform putting guidelines there for nurses and midwives to look at to make sure that they are not getting caught up in any unnecessary fees or being required to stay within an employment situation for longer than what they would like. And these are the types of things that as you are making your career decisions, you have to be very aware of. And these are things that we don't get taught in nursing school, you know, but so we as a service should be providing that to really help you, to guide you in those areas.
Thank you. I also want to add and say TruMerit is and Graduate Group believes in ethical recruitment. That you as a nurse, as you go out there, you go in dignity, you serve in a dignified environment. That is what TruMerit and Graduate Group stands for. And we are saying as nurses, we need to do things the right way. Before you take anything from anybody, you need to look at, is this person credible? Are the contracts which you are signing credible? Are they giving you dignified working environment and also remuneration? Those are the key things we need to address, because we have seen nurses in Africa getting conned. Do you know that? You pay money and your money goes. This platform is going to make things straight. It is going to secure your movement to the next level. This platform is going to secure everything and give you good opportunity to link up with certified employers. And I want to thank TruMerit, because they are the ones who certified employers and also agents which recruit people. Lastly, just what Daniela said, and also Peter said it, the key thing is once you get an employer from the platform, some of the employers, they are willing to support you. they are willing to support you to pay your NCLEX exam. They are willing also to pay for your transport, your relocation cost. With the agreement in future, they can also recoup it from what you're doing. So those are the things we're thinking through, and I know once this platform is on board, it's going to change how things are done. Thank you and I appreciate it.
Thank you. Yes.
Thank you very much. My name is Boniface Kokwabero. Madam President, I want to thank you for giving us this opportunity and for creating the avenue for us to have this platform. We've heard a lot from TruMerit, and we've heard from the President that the platform is going to be free. And I want to find out from you, what then does TruMerit stand to benefit from us? If you are giving us a free platform, is it just solely free, or you stand to benefit something from anybody accessing the platform going forward? Again, I want to find out, when does TruMerit leaves the scene? Is it when I get the employment, that's when you leave the scene, then I deal with my employer directly? Or you stay with me throughout the journey till I move from my country of origin to my new place of work? Thank you very much.
Thank you.
No, thanks for that great question. And what I would say is that registering on the platform is free. There will be other programs and services ultimately put onto the platform. Some will be free. Others will be for, you'd have to pay for, depending on what it is that we would have on that platform, like career development initiatives, or our certification exams, or our micro-credentials and digital badges. Some of those that we will have people pay. One of the issues that we're talking about right now is dynamic pricing. So we would be looking at World Bank income levels from around the world, and to be able to price those programs and services based on World Bank income levels. So these are the types of things that we are developing right now, and why I said earlier, what an opportunity in doing this collaboratively with countries like Ghana, Kenya.
Somewhere in the middle of the journey. The platform is also made to track your movement and also for you to give feedback. Because if you have been employed in Minnesota, for example, the platform will show that you are in Minnesota and you will be giving feedback. So this thing, it's a journey with you. We are not going to leave you behind. And then the other thing, what I can say, there will be a lot of educational material into the platform. For example, there are issues, I was talking with Peter, issues of culture shock. What are you supposed to prepare if you are relocating? Such educational material to prepare you as a nurse and a midwife to take jobs abroad, they will be there. But informational materials will be free. But there are those, what my president, CEO Peter has said, there are some of those services which will be a charge. Thank you.
Hello.
Yes.
Yes. Please, my name is Wahaumina, and I want to say a very big thank you for this opportunity. Please, my question is for Mr. Peter concerning those who have already started the NCLEX process and are having issues with their portal. I am an example of having issues with my portal because there are instances where documents have been submitted and ticked green, but it's still pending, and I get email that they need further action is required, which I've been going forth and back with TruMerit on the portal. An example is my school credentials. I submitted, they gave me a form which I submitted to my school. They sent the transcript and everything. It was ticked green on my portal, but they sent me a message on the supplemental portal part. They are saying further action is required. I'm going forth and back with them till date. It's almost 3 months now, and still it has not been resolved. So I want to know what are some of the plans to improve real-time updates. Yeah, thank you.
Thank you. So when I first started as the president and CEO, we were really challenged with the pandemic and the post-pandemic. So the pandemic hit in 2020, and it prevented health professionals from migrating around the world. So when countries began to open up again and individuals were allowed to leave their country, we had a large number of people that wanted to migrate. So we had a backlog of 60,000 applications. We've since cleared up all of our backlog. And we also had a problem with the processing of applications, where it was taking on average 10 months to process applications, and we're now down to 3 months. But there are still issues that fall through the cracks, and if I can get your name, and I will follow up with you on some of these issues. What we're doing is we've created a credential transfer portal where we are digitally connected to issuing authorities, meaning university registrar's offices to receive transcripts, registrars, ministries of health, to be able to digitally have them send materials so that they do not have to send it through traditional mail services. We were, back in 2023, we were receiving 5,000 pieces of mail a day. We're down now to half because of the credential transfer portal that we've put in. So it's much more reliable. And again, we do a lot of this work for fraud prevention. That's the challenge. It's to protect you as the applicant and to protect the individuals that are interacting with you as the applicant. Some of you might have heard of some of the challenges that occur where there are what they call these diploma mill schools, where they want to take your money and then it's not legitimate, it's not a legitimate school, and we cannot credential individuals from illegitimate schools. So we've put into place fraud protections and fraud surveillance. Now, I'm not suggesting that that's your case at all, and I'd like to, we can talk offline about yours, but sometimes these challenges, things fall through the cracks, and what happens is we don't get the cooperation of those issuing authorities. So we try to work with them, and what happens is the staff are working behind the scenes with that, because we accept only primary source. We only will accept information directly from the source. Again, that is to protect you, and that is considered a best practice and a gold standard for those organizations that work with us that would be employing you. So these are the things that, but there are technical issues sometimes and challenges that occur. But let me work with you afterward, and we can figure that out. Thank you for bringing that up.
Thank you. Fine. My sister, I hope your ticket is ready. Because the president himself is going to do a follow-up for you. Thank you, Dr. Peter. Yes.
All right, thank you. I am personally very excited about this opportunity because it's one of the things I've been looking forward to. My name is Emmanuel, and I'm a psychiatric nurse and I'm very happy about this. One thing I want to find out is is there a chance for people who have been trained and they are waiting in the house 5 years to get an opportunity to practice as clinical nurses? Because most employers will require some form of working experience. So that is one of the challenge I've picked up from this engagement. And I want to find out how is that going to be addressed, since that was one of the key findings that we said that there was an employment training or recruitment or employment gap. We have people waiting. So is the international community ready to accept people who do not have years of working experience? That is what I want to find out first. Thank you.
No, it's another excellent point that you raise, and this is something that you're absolutely correct. To be able to work in the United States as a nurse, you must have at least 2 years of work experience. But if you haven't gotten that work experience, you can't work. I do think, though, that what happens is that, and we see physicians that come into the United States that cannot get credentialed as physicians, they try to become nurses, which I don't agree with, because we're very different, the work that we do versus the work that a physician does. We're both important, but we do very different things. But this happens. I think that this is an opportunity as we begin to evolve our collaboration and look at bilateral agreements from one government to another, but through the private sector, is to look at ways that we can help to upskill individuals in their country of origin while they're waiting, and then to be able to then move them over as they have gotten that experience. But that's going to require working within the country of Ghana or other countries that we're working with, because it's very different in every country in terms of the requirements and how to work around some of those issues. But you're absolutely correct. That is the requirement right now, and those requirements are set by the licensing authorities. And in the United States, it is different for every state in the union, whereas Canada is different. The provincials there, they have provinces in Canada. There is greater harmonization. So if you come into the province of Ontario to work in the city of Toronto, you can go to work in Alberta, Vancouver. You can go in other parts of Canada if you choose to do so. In the United States, it's very different. We're wanting to work with the National Council of State Boards. They don't have oversight. It's individual states and their state legislators that make those determinations. But what we've done in the United States for nurses that were educated and licensed is to create a compact. So you can practice in one state and go to another state or to another state. It's kind of like a driver's license. You can have reciprocity, if you will, from one state to the next. We want to do that for internationally educated nurses and other health professionals coming into the United States. But right now, it's mandated by individual states. But there are things that we need to continue to work on and learn from people like you to find out strategies and solutions to be able to address that. But I don't want to promise here that this is not a short-term issue. This is something that will take some time, and this will require involvement from the appropriate organizations. One of the things that I was very inspired to hear about from your president, Perpetual, at the GRNMA meeting is the alliances that are occurring around the continent of Africa with nursing and midwifery associations, with the the midwifery council, the nursing and midwifery councils, as well as, you know, the educational organizations, to come together and to come up with strategies like this to be able to address these issues.
Thank you. So with my follow-up, so I have as well. I realize that our curriculum that is built, plus the learning materials we use, most of them are foreign-based. So already I will say that we have that background. So my question is, okay, let me just reframe this. We have that background, that training background, foreign-based training background already. But you are required to do another licensing exam. That is for NCLEX and the other ones. Is there a way that this platform could harmonize that instead of, so that we kind of have an international license? That is what I'm just thinking about. You have an international license, that collaboration. From the training institution, you have that background. So can NCLEX or those other international exams be incorporated so that in case you are not employed right from graduating, you didn't get a chance to be employed in your home country, since you have that international license exam taken from the training institution, then you are ready to even apply for employment right from the go to the international community. That is my suggestion.
No, and I think it's a good suggestion. The challenge that we experience, and now we have seen hundreds of thousands of nurses that have come through our examination processes since 1977. We're almost 50 years old. And what we find in terms of where nurses in certain parts of the world have challenges with is around critical thinking and problem solving skills. They may get a similar type of a curriculum that's based on a US educational program or a UK educational program or an Australian program, but there still are challenges around the way that learning is transferred to the student, and if they understand that from a critical thinking, problem-solving perspective. The expectation to practice in a country like the United States is one where you have to be much more independent in the way you practice, and that's variable as well. I mean, I've talked to nurses, I've talked to midwives from Nigeria that have come to the United States, and their scope of practice is much more restricted than what they're able to do in Nigeria, as an example. But what we find is that nurses that are coming into the United States from different parts of the world are having challenges, even though they've gone through educational programs. They've had challenges with community-based practice. Public health was mentioned back here before. And these are expectations of general first-level nurses coming into the U.S. Now, psychiatric nursing is a little bit different because that's generally held at the advanced practice level in the U.S. but not in UK and Canada. That's the other challenge. Nursing education and nursing practice around the world, and I spoke with the president about this just the other day, it's so variable. It's so different from one country to another. Even in a country itself, it's very variable, like the United States. These are challenges that we are going to have to address from an advocacy and a policy perspective. You're fortunate to have President Perpetual on the ICN board of directors where they discuss these challenges, and we work very collaboratively. We have had a partnership with ICN TruMerit since 2008. We have what we call the Global Nursing Workforce Center, where we are now doing evidence-based research on nursing and midwifery practice, so that when they go to the World Health Assembly to talk about interventions on behalf of the nursing profession, that there will be more evidence-based reporting and interventions. But these are challenges that we'll not be able to solve overnight. And I agree with you, there definitely needs to be greater harmonization because the world is small. And with digital health and telehealth, where you can transmit and you don't have to leave your home, we're going to have to prepare our clinicians to be able to deal in that new reality.
Let's put our hands together for Peter. I just want to add a bit. You know, what you said, it's come up time and again in various engagements or forum. And until the world unites on standardizing nursing education and training, it will be very difficult to know how to go ahead with what we are proposing. On the African continent, just as Peter said, the African Nurses and Midwives Confederation has been formed. The maiden conference was held here in Ghana in February 2025. The next conference is in Livingstone, Zambia in March, this March, 2nd to 7th March. And the ANMC website is open, www.afanmc.org. Visit the site and follow the news, follow the information, and you can register to participate yourself. I said www.afanmc.org. And the vision is to start the discussion on these things because our neighboring country, Nigeria, has stopped training enrolled nurses several years ago. We are still training them. We've advocated for it to be stopped, but it hasn't stopped entirely. Plans are far advanced, but yet to be implemented. We need to be able to say for ourselves that even if you take the sub-regional blocks, whether Eastern Africa, Western Africa, Southern Africa, or Central Africa, this is how nursing is. This is how the training should be. Then it makes it even easier within the sub-regions. Then, of course, the whole continent can have it in a certain way before maybe at the global level. But I understand Peter when he says, these are the challenges. And until we have solved it through strong advocacy, it will be difficult to say you are here, you are trained, but the standard certification that is required for you to practice, let's say in the US or in Canada or in Australia, can be waived. There's a lot of work that needs to be done. And I'm hoping that as we all become voices of change, no matter where we find ourselves, we can continue to advocate for some of these things and ensure that maybe not in our time, but in the future, it really happens. Thank you.
Thank you, Madam President. Okay, before then, please, all those joining us on all our social media handles, you can keep your questions coming, and then I'll read them here, and you receive your answers. All right, please.
All right, thank you, Madam President. Thank you for this opportunity and this gathering. And my question has to do with the cadre of nurses getting opportunity for the international community. A lot of time when you go through the qualifications, the general nurses that are really sought after. So I would like to find out from Mr. Peter if with TruMerit, there will be a lot of opportunities for midwives and then public health nurses. Thank you. mental health nurses?
Let me try to address it before Peter comes in. You see, our problem in Ghana is the fact that we are doing direct midwifery. Direct midwifery. Direct midwifery is the problem. In most countries, midwifery is a specialization. It's a specialized area. So you first need to build a strong nursing background before you do midwifery. In the past, that is how it used to be in Ghana. And the policy to train midwives directly came into force because the midwifery workforce was dwindling. A lot of them were aging. They were going on retirement. We needed to reduce maternal and neonatal deaths and all of those things. And we started direct midwifery. It was supposed to serve a period of 10 years. And then we revert back to the old system. But we never did. And we've been on this trajectory up till now. When Barbados came, Barbados has recruited 3 cohorts from Ghana. Not a single of those cohorts has midwives. And what is the reason? In Barbados, you need to have a first degree in nursing, having practiced before you do midwifery. So if they take you a midwife from Ghana and take you there, how are they going to license you? How are they going to get you a license to practice? It's not possible. Because they won't change their licensing policy overnight to suit what it is that we are doing here. So that's why we've been advocating for this, that it's important we revert back to the old practice, which will safeguard the interests of our midwives and even curtail the issues they have. Some of them say, oh, I'm a midwife, I'm not a nurse. What the hell do you mean? Because when you are a midwife, most of the things you do in terms of practice is nursing. It's nursing. And the training itself is such that you do 1.5 years nursing and you do 1.5 years midwifery. So you are a nurse. Even if you are referred to as a nurse, you shouldn't have any problem with it. But we know the sentiments that run amongst our rank and file. And it will be in the interests of midwives to start advocating for this change themselves, because it will be to your own good. If we have a training in Ghana such that you all do your first degree in nursing and then you begin to branch to do your specialization in public health, in midwifery, in psychiatric nursing, in this and that, you finish that and you can even now go and do the specialist program at the Ghana College of Nurses and Midwives. Then it helps all of us. Then it pushes our premium. It also pushes our premium forward, and it becomes easier for us to negotiate for what is duly ours. And then when we go on industrial action, we don't have Ghanaians insulting us that we don't have the requisite academic background to even speak for what is rightfully ours. Because in their minds, they still see nursing and midwifery as it used to be in the 60s or 70s or early 80s, not realizing that the profession has changed. We are moving forward, and we have many of us who are not only PhD holders, but are professors, and are making impact. For those who don't even have a PhD, I'm constrained with time, and I've not been able to do that. But we are making impact. We are making impact everywhere. And I'm saying this to say that even if a nurse or midwife is not holding a PhD, by the mere fact of our practice, we are leaders, we are reform activists, and we are influencing policy by our practice. And we have a lot of information, a lot of experience, and that frontline lived experience should propel us to actually be the voices of change so that we can have change within our system. Okay, so advocacy, advocacy, advocacy. Let's see how it goes in the months and years ahead.
Thank you, Madam President.
I can say,
yeah.
Can just add something what President has said. In Kenya, in Kenya, we had Kenya registered community health nurse. That is a diploma in nursing. The reason why we had KRCHN, it was to build an all-round nurse who can work in everywhere in healthcare system. And KRCHN worked so well for Kenya. But over years, we got infiltration from donor-funded and driven agendas. You get that? They came and said, we can have midwifery at diploma. We can have psychiatry nurses, my tutor. But then we realized some of these initiatives are making nurses not to be competitive globally. And we, as the National Nurses Association of Kenya, with the nurses, we started a conversation. And we said we need harmonization of our training. And our council, the Nursing Council of Kenya, listened. And we have a circular that we are going to harmonize our training in Kenya to have every nurse have a competitive advantage when it comes to global opportunities. You have the power to advocate it. The way President Perpetua said, start the conversation. As nurses, as midwives, what do you want to do? Lastly, why you as an individual nurse or midwife, why do you want to take a course which is disadvantaging you in some of the aspects? It also depends on what you believe in. But advocacy, policy change to make sure we have a consolidated nursing workforce and competencies. It is what we need in Africa. Thank you.
Thank you, sir. All right.
Okay. Good day to you all. My name is Mills, and my question is related to the specialty aspects. So as Mama was talking, she said the reason why the midwives having challenges are because of the direct entry. But I was looking at the aspect of some other specialties like perioperative nursing, critical care nursing. We usually do the normal nursing first. You have to work and gain some experience before you can even apply to practice that advanced level of nursing. But you realize that most of our colleagues, when they go out, they still go and practice as the general nursing. So I want to ask, if this platform comes in place, is TruMerit or Godwit going to put some bridging gap between this coming back as a normal general nurse, leaving your specialty aside?
So one thing I want just to comment is the TruMerit Godwit platform. It's an equal platform for everyone. That you as a midwife, you as a nurse, you have the opportunity to upload your profile. That is number one. And what the CEO TruMerit has said, we want to have features which can support capacity building for nurses. But also, as we look about those global certifications supporting capacity building, the basic training for you as a nurse and midwife, where you started, is very important. And I want to say that as a country, that conversation must start. We are saying we want you to start training as a nurse. And then you can have specialization at higher level. That one makes you to be competitive globally. And that is what our President Perpetual has said. But in terms of the platform, we are looking forward to have TruMerit Godwit have some short courses or courses which can also upgrade your capacity building as a nurse. Thank you.
Thank you. I think we take two questions more. Please, have you exhausted all your questions?
Online, if you can take one or two from online.
That's one. It's not a question, actually, it's a recommendation. Someone is saying it's a commendation. Elizabeth Baden says our president is doing marvelously well. More grace to your elbow. Please keep your questions coming online. Keep it coming. We will read them. And then you get the answers before we sign the MOU. Please keep your questions coming. Have we exhausted all the questions? Yes, please.
I just want to make a comment to follow on with what the president was saying earlier. We have to recognize, first off, Africa is our next generation. This is the future of the health profession. And that means that we're going to have to look into the future in terms of how we're going to be delivering care. It's evolving rapidly. You know, I talked a little bit earlier about telehealth. Artificial intelligence is going to change the way we do practice. There's ambient listening now. There will be ways that artificial intelligence will be able to assess the patient environment to determine its safety, and how we as nurses, midwives interact with this technology is going to be critically important. It's going to require a different skill level from all of us. So we're going to have to think not what was once happening, but where we're going and what we need to be doing. And I think that's really important because the challenges that we have, the frustrations that all of us have, is we have systems that are from the past. And we have to break out of those systems and to look anew, to be able to address the challenges of patient populations. We've never had this level of disruption from climate change. We haven't seen the types of war and conflicts that we're seeing in today's environment right now. And what we have to work in as nurses and midwives. So we have to think about where we need to be, not necessarily only where we've come from, respect the past, but let's think about where we're going to be going. Where I live in the United States, in the region, the Northeast Corridor, we received a huge grant from the federal government around precision medicine to be able to look at treating individuals at the molecular level. This is the future. And what will that mean for us around care delivery? What will that mean for us in terms of the science of healing, the science of care, and what we need to do to evolve our practices to keep up with the longevity, the length of time that people are living. There's expectations that we'll be seeing people living up to 150 years old. And what implications will that have for us as caretakers, as care providers? So I just wanted to encourage you, and I was inspired by what the president was saying earlier, and I just wanted to put that out there as well. Thank you.
Thank you. I think there's one question here, and I'd like to read it. From Millicent Na. She says, does this give opportunity for registered psychiatric health nurses to go through with credentials evaluation for the NCLEX without any issues or rejection? For our psychiatric nurses?
Thank you. For NCLEX exam, there is always a criteria which you have to meet. And the process is your documents need to be verified first by TruMerit, credentially done, and then you can be given the authority to test through the Pearson VU. So what the person who has asked that question needs to do, it is to apply for evaluation, and then report will be given whether that one will be possible. One thing I must say, the challenge we have been having is some of the training are not meeting the hours required. They're not meeting the hours required. So the best option is to have evaluation, and then if the person qualifies, meets the required hours, then they can go forward for the NCLEX testing. Thank you.
Thank you so much, Dennis. Just to the question that you asked earlier, the point is that when you use verification platforms for a certain certificate, when you enter that country, you can only practice on what has been verified. If you have other qualifications and you don't take it through the verification system, don't expect that you have those qualifications and you should be allowed to practice. It doesn't happen. You get it. So if you want it to be worthwhile, then make sure you get it verified, then it's part of your portfolio, and then you can practice on those levels.
Thank you. Madam President, I think majority of the questions online have been answered.
Okay.
Yes, but there's one here. He just came in. He said, I want to find out why it is that Africa-trained nurses are forced to write English proficiency exam before being recruited into the foreign workforce. Meanwhile, it's English that is used in our educational system from basic to tertiary. Will this system help eradicate such policies? That is from Watson Isaac, second vice chairman, Bonga Half.
That's an interesting one. But the truth of the matter is we all go to school, different kinds of schools, and our proficiency in English is varied. People speak English differently, people write English differently, and they understand it differently. We can all sit here, we hear the same thing, but if you are asked to narrate what has been said, everybody will say something different. So the English proficiency exams is just to understand that you can actually speak, understand, and write the English such that where you are going to practice, where English is their native tongue, unlike Ghana where Twi, Ga, Hausa, or any language is your mother tongue. When you get there, where English is their mother tongue, you can actually engage, care, without language or communication being a hindrance. So as for that one, it will stay. It will not change. So just let her know that so far as English is not our mother tongue, we would have to show that we can speak it, we can write it, we can understand it.
All right. Thank you very much, Madam President. Well, Mr. Isaac, you just heard it. We are still writing English proficiency. Thank you. Please, are there any other questions that you would need presidents to address? Please. We are done. Okay, so the moment we have been waiting for, now is the time. Now is the time. Yes, so very soon the deal will be done. The signing ceremony between Ghana Registered Nurses and Midwives Association and TruMerit. It is just going to take place in the next second, a minute. I don't know. But I'm sure our fingers are crossed. Because, should I say, our destiny is going to be determined. And this is a good one, of course. This is a good one. So the moment we've been waiting for, please help me. Help me with a round of applause as we see the two presidents, Mrs. Perpetual Fori Ampofo, walking towards the place to sign, and the president, Dr. Peter Pezerasi, also walking here. And of course, she's calling in her team members to give the backing. Of course, we have the men. So it is ongoing. Media, can you prepare our anthem so that the anthem will be played immediately the signing is done? Signing is ongoing. People are buying their tickets in their head. The General Secretary is, of course, seated beside the President, and Mr. Dennis is also supporting Dr. Peter Preziosi. I can see the President signing already. This is a confirmation that the platform is indeed going to benefit nurses and midwives in Ghana. The deal is almost done. It is almost done. Madam President is on the second signing. Saber. And of course, I have seen witnessing from the General Secretary, Dr. Chum Tenkwai. Please, is the anthem ready? There's one last question. At this crucial moment, very important. Madam President, would you want to hear? Okay, she says you should go ahead. Hold on with the anthem, please.
So,
can you ask your question, please?
Yes, it's very essential at this very moment. I want to find out.
Okay.
We have some PhDs societies in Ghana.
The PhD, can you please
pull him down?
Oh, okay.
Groups, or the SUSU groups, as we call them. Okay. I want to find out if there is a passcode that only GRNMA members will have to be able to access this very document we are signing, so that people will not benefit from our sweat and hard labor. You understand? So that they will know that Madam President single-handedly led us to achieve what we are witnessing today. It is very important and it's very fundamental that we get it made clear, loud and clear, so that they will know the benefit to belong to this association. You don't need to think twice to belong to GRNMA. It is the mother of all. It is a recognized body, international. Even Peter rightly said, Madam President was acknowledged far away. Thank you. I rest
all
my
right.
case. Thank you.
The platform I was discussing with Dennis, the platform will sit on the Infonet. We are going to work it out, so it's not a problem. Peter, we have an app. We have an app as an association. We have an app both on iOS and on Android, and it has limitless opportunities. So we should be able to integrate the platform on the Infonet. That is where we know we have our paid up members, and they can easily access the platform. Yes. Woo, 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 woo. So now we'll just do the ceremonial
anthem.
No, with the
Our members should be aware.
So the deal is done. Out of excitement, the media man immediately threw me out. Yes. So the deal is done. Led by President Perpetual Ofori Ampofo and Dr. Tenkwan Chum. The deal has been done. Thank you. The anthem, please. Shall we please be upstanding for the anthem?
GRNMA, unity, strength to serve our motherland. Diligent in living care to all to make our nation strong. Greenness in our motherland. GRNMA stands for.
Unity. Unity. Nasazoye. Nasazoye. So, midwife Zoe. The choboy will come from Madam President. Everyone is asking for one choboy online, please.
Choboy! Boy! 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 Yeah. Peter, we have a small presentation for you and Dennis, but we'll move to the front so that I can do that with your kind. You can take your seat. You can take your seat. So this is just something small from the Ghana Registered Nurses and Midwives Association to you, Peter. We appreciate your time with us. We know you are a very busy person, and we are honored to have you with us today. As you go ahead, remember GRNMA, remember the need for us to write our NCLEX in Ghana. Remember that we need a more enhanced Godwick platform where a lot can be achieved, and we believe this collaboration will go far. And the work we do ultimately is to safeguard the interests of nurses and midwives globally. And this partnership, we believe, will go a long way to help our Ghanaian nurses and other nurses and midwives on the African continent. So on behalf of the association, I give you this. It's a shirt. I hope to see you wearing it one day. For you, Dennis, this is also something small from all of us. You see, Kenyan Nursing Association have not been selfish. When they got this platform, they thought about Ghana. They said, our brothers and sisters are in Ghana. Let's reach out to them and let's have this done. And they are here. So Dennis and your team, we say thank you. This is a shirt. I know you will love wearing it. Thank you so much. There is one more thing. Something for you, Peter. It hasn't arrived yet, but at any point in time, when it comes, I'll let you have it. Because I know after the break, you'll be having your second meeting. Yes. If it doesn't come before we end the photo session, before that meeting, we'll do that presentation to you as well. So thank you again for everything. MC, let's start with the pictures.
So please. National Council members, please. Greater Accra Executives, National Council members. Greater Accra Regional Executive. Then the Regional Council can join. Greater Accra Regional Executive. Greater Accra Regional Council, please. Get ready and join. Regional Council, can you please be upstanding and then join them on the stage? Regional Council members. Greater Accra Regional Executive Council. Madam Lord. Please, ladies and gentlemen, you can join. Yes, be part of this historic moment. Please be part of this historic moment. You can climb up, please. Some of you can climb up on the podium, please. You can go up. Mr. Sopal. So we do a cheese to take the picture. Cheese, 1, 2, 3. Choboy! 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 Yeah. Oh, TruMerit. Thank you. Thank you very much. Please, let's be seated. There's another presentation. Can we please sit?
GRNMA, unity, strength to serve our motherland. Diligent to be, living care to all to make our nation strong. Greenness in our motherland. GRNMA stands for strength.
Okay. So we take our closing prayer. Okay, so it's time for our closing prayer, and we have Miss Sonia in our midst. Sonia Mayer from Ridge Hospital in our midst to do us the honor. Please welcome her with a round of applause.
Please let's pray. Our Heavenly Father, we thank you for your success. We commit today into your hands. We ask that even as we have signed this memorandum of understanding, you make everything fruitful. You aid us in strengthening unity. In Jesus' name, amen.
I got to know that short prayers are very, very, very potential. So this prayer is taking us right away to USA, New Zealand. Amen.
So kindly be seated. Continue to be in your seats. There's packed lunch. It will be brought in shortly. And the media team can give us some music whilst we step out to my office. Thank you so much for coming.
On behalf of Madam President, we want to say thank you very much for your time with us this morning and coming to honor this invitation and also being here with us throughout. Thank you.
Imagine a world without nurses. Our hospitals, our clinics, they'd just be empty buildings. There's not an area of healthcare where there isn't a nurse involved. Not just hospitals, but it's communities, it's research, it's education, it's the military. Nurses make up about 60% of our global healthcare systems. And what those nurses are doing is not just providing care when you're sick, but they're providing advice and help to prevent you getting sick. If you are sick, to manage a condition so you live the maximum possible life. If you're at the end of life, to death. You look right along the spectrum of life, all the aspects where you're going to have care, you'll find a nurse. Nurses are the backbone of our health systems. But the World Health Organization reports that we have a global shortage of nurses. When the demands on health systems become overwhelming, when they become incredibly urgent. How do high-income countries address that? They look overseas. They recruit internationally.
I wanted to explore being an ICU nurse in the United States because it's very limited here in the Philippines, especially with the technology we have, the ventilators and the patient monitors that we have. I wanted to be able to give more to my patients without constraints. I don't know anybody in Jersey. I'm really going there alone. All the what-ifs are in my mind right now. What if I'm only a good ICU nurse in the Philippines? That's what scares me the most.
I came from South Korea 30 years ago. I totally understand her. She's so brave. She come herself. Boom. Language is totally different. And the electric charting, so difficult. She's learning so quickly, and I can give her all my knowledge, all my trick, and make her successful.
Nurses have always moved and migrated. There is intrinsically great value in migration and in movement. The sharing, the learning, working in other systems. But if we're committed to ethical recruitment, there has to be mutual benefit. There has to be some give back commensurate with what is being lost. And the ratio of nurses to population around the world varies hugely. There are many countries who are losing nurses that they can ill afford to.
On average, about 500 nurses are leaving every month. Every month. We are also having to deal with the dilemma of how to recruit our nurses who are at home, fully qualified to practice, but they have not gotten placement in a public hospital.
When you pass your exams, you have to wait for the government to post you. So you can be waiting for 4 years, 5 years, and the family will see you as not being useful. You become a burden on them. If there is an opportunity, an opportunity comes and I have to grab it, I need to grab it, then go find greener pastures.
I dedicate a lot of time in this place just because I love what I do. My help is really needed. That's basically why I'm still here. When the opportunity comes and I think I have someone to replace me here, I will take the opportunity.
We are just losing the best of our professionals.
I am on a mission to invest in the nurses here, to stay here in Ghana.
We can stay in our country and make it better. It starts from us.
Just like the saying, little drop of water make a mighty ocean. It's all our goal to make sure the care that somebody's getting in the US is the same care that somebody's getting here in Ghana.
We think about health in terms of our village, our town, our community, or our country. But good health isn't made on the basis of where lines on a map are drawn.